Hey there, it's Dominique Well from Well Medical Arts. We just finished Saturday and now we get to do the staff. Yay. This is Katie and we get to watch Radiesse into the cheeks. Radiesse is my favorite biodegradable filler because it's the thickest filler of all of them, made out of calcium hydroxylapatite. It will give a really nice lift with the smallest amount of product, so it's a great workhorse for me here in the clinic. Okay, to do the cheeks, first I like to draw, and just to go over how I draw, I will use the lateral brow and come down. I will use the canthus and come down, and just put about 1 centimeter in between each bolus. And that's to do a lateral cheek. To build some cheekbone, baby. Tell me when you're good and cold. These little ice packs work great.
All right, let's do it.
You're good?
I'm ready.
Okay, so first the hand, and I like to kind of tug back to help it anchor a little bit. Take a breath in and exhale. Not too bad. So go down, tap the periosteum, and then frequently when you start injecting, you might be able to hear it a little bit. And with the Radiesse, sometimes you can hear a little bit of a crackle. Can you hear that?
Mm-hmm.
Uh-huh. That's normal. That's good. And so injecting really nice and slow and steady helps cause less tissue trauma, less swelling. Nice. And then go across and just hold a little even pressure for a second. All right, so now we're gonna do the other side on Katie. This will be syringe number 2 of the Radiesse. Typically, that's what people need for a nice lift. All right, take the breath in and exhale, tiny poke. Good job, babe. Good job keeping calm with the breathing. And then slow and steady, easy does it. You're doing great. Yeah, big cleansing breath. Shake it off, right?
You know, it really isn't bad. It's just for a few seconds, but I can feel the pressure a little bit. It's just a weird sensation, but it's really not that as painful as I thought it was going to be.
I feel the same thing. I feel the poke going in. It's not bad. 0 to 10. Nobody's given me over a 3. I would have given it about a 3 myself.
Yeah.
And then I feel the pressure as it starts to fill up. Tell me when you're good and cold. Sometimes the ice hurts more than the filler, actually.
I'm ready for you.
Ready? Mm-hmm. All right, yeah, you're good and frozen. Look at that.
I'm like, yeah, I feel it.
All right, breath in and exhale, babe. Good job.
Mm-hmm.
Next thing you know, I'll be IPLing you.
Mm-hmm.
She's like, no.
That one's a little ouchy. Not this, the IPL.
The IPL, right. Almost. There we go. Awesome. All right, and let's ice.
Mm-hmm.
Right. Got it.
Thank you.
Tell me when. Nice. Turn towards me, let's see. Oh, it's looking awesome.
Yay.
Yay. Okay, so we're gonna put more arnica on and sculpt. We just did 2 syringes of Radiesse in the cheeks to lift and contour. What we can expect is to have a little bit of swelling. Just this little pinpoint bleeding doesn't usually really bruise. It's if it really drips that it bruises. I think all of these are gonna be fine. She'll be swollen about 4 days. Some people a little less, some people a little bit more. It also goes through a couple of stages of healing. First, you can actually kind of feel the Radiesse in there. It's a little bit firm. It's also a little swollen and kind of squishy. If you are a swelling will go to the path of least resistance, which is kind of up here. That's typical for a lot of people. And then the filler kind of integrates into the tissue. You don't feel it as much anymore. And then it goes into a phase where it's building collagen. As far as how long it lasts, different for different amount of people. I've seen it be as short as people wanting to do their cheeks every 5 months. And I've had women say it lasted them over a year, 15 months. So I think it also just depends on how good you keep it, how high you want to keep it, and how much collagen you have built from it, how much of that collagen is remaining. But anyways, we love it.